Hi Tina, my name's
Hi.
Brandy. I'm going to be your nurse practitioner today. Today we're going to do the neurologic exam and a musculoskeletal exam. So starting off with the neurologic exam, you just assess your patient, ask them name, date, and location. So can you tell me your name
Tina.
and today's date?
June 13th,
Uh-huh. Do you know what?
2018.
Okay. And location. Where are you right now?
Pittsburgh, PA.
Okay. So after you've assessed that, you can also assess the speech, the quality of their speech, their articulation. You'll also want to assess their thought process and you can even assess their math knowledge, like what's 2 plus 2?
4.
Okay. So after you've assessed their overall neurologic status and their orientation, you can then really move on to your musculoskeletal exam. So to start out, we'll start with shoulders. Initially, when you're looking at the shoulders, you just want to do your inspection first. So you just look at the overall symmetry of the shoulders, assess for any nodes or anything like that, and any redness or areas that look a little infected, and also assess if they're having any pain that they're complaining of. After you've inspected the shoulders, then you can go ahead and actually identify the parts of the shoulders, the joints and the muscles that we're looking at. So by starting at the clavicle, sorry, my hands are cold. Starting at the clavicle, you can come over to the acromion, and then you can identify the head and process of the humerus. And you can even go down to I'm sorry, lost my train of thought there. But you're just feeling for masses, any swelling or tingling, any heat or anything like that. And you repeat that on the other side. After you've assessed and palpated your joints and muscles, you can then move on to your muscle strength and range of motion. So initially you can do abduction and adduction. So to do that, you just take both your hands, bring them up, and then you bring them all the way back down, and that's abduction and adduction. Then you want to go ahead and move on to internal and external rotation. So you can just bring your hands up like this and rotate them in, and then this way. So as long as they're not complaining of any pain there, then you can move on to special testing. To test for any shoulder injury, you can do the Hawkins test. To do this one, I'm just going to have you hold your right arm out straight. So you take the patient's wrist and elbow and kind of assist them into this position just by rotating the elbow in. If they have any pain in their shoulder, that can be a sign of an injury. And then you can also do an apprehension test, which is just by assisting the patient's arm up about this length. They're going to start to be apprehensive of pain if you try to rotate the shoulder backwards. Also indicates a shoulder injury. Once you're done with your shoulder assessment, then you can move on to your upper extremities. Identify, again, just the arms, symmetry, shape, color. And then you can identify your muscles, your triceps, biceps, and brachioradialis muscles. So to do that, you can actually palpate triceps and biceps, and then your brachioradialis. And after you've palpated, you can go ahead and again do range of motion and strength on the upper extremities. So initially you can do adduction and abduction. So again, you would do the same test that we did before. And then you can do flexion and extension. So bring both your arms up and extend them out. And while you have them out, you can ask them to open their palms. And this is the supination position. You can also ask them to do the pronation, just flipping your hands over. And if there's any pain there, then you can move on with that assessment. After you've done upper extremities, you can move on to elbows. And once you after you inspect your elbows, you can go ahead with palpation there as well. The inspection's pretty across the board. You're just looking for tenderness, any heat, anything like that. So once you've done that, you can go ahead and move on to the elbows. You'll identify the medial and lateral epicondyls, and then also your, gosh, I can't remember the name right now. My brain. Your olecranon process, I'm sorry. You're going to palpate all of these and assess for any pain or tenderness. Once you've done that, you can go ahead and again do the same things. You're testing your extension and flexion, and then your pronation and supination to assess for any pain. After you've done elbows, you can move on to wrists and hands. For the wrists and the hands, there's quite a bit of tests for these. So initially you just want to look at inspection, and then after you've inspected, you can kind of hold your patient's hands, palpate around, assess for any pain. Once you've assessed for pain, you can go ahead and check range of motion and strength. So for range of motion, you can do just make sure that they can do flexion and extension, they can squeeze your hands nice and tight. And then also that they can hyperextend their fingers. And as long as they're okay with that, you can move on to strength. Again, you can do the hand grasp. And while they're flexing, you can put some pressure on their fingers just to make sure that they've got some strength. And again, extending, you can push pressure there. After you've done that, you can move on to point-to-point localization. So for this test, you just do your finger-to-nose test, and it's just checking for coordination. So start with your finger on your nose, and then I'm going to point my finger out, and you take your finger and point to mine. And again, you would do this assessment on the other hand as well. Another test you can do is proprioception, which is where you have the patient close their eyes, and they're going to positively identify any movement that's going to happen in their fingers. So if you hold your hands out, you just tell me with your eyes closed if you feel your fingers moving up or down.
Up, down, up, down.
And that's good. After that, you can do stereodignosis, which is basically where you just place a random object in your patient's hand and have them identify it with their eyes closed. So keep your eyes closed. And hold out your right hand. Tell me what that is.
Pen.
Good. So that is stereodignosis. You can also do graphesthesia, which is where you hold out the patient's palm with your eyes closed. I'm going to draw a number in your hand and you tell me what the number is.
3.
Okay. You can repeat that again on the other side. And then after you've done that, you can do touch, pain, and vibration. So for touch, again, you just have the patient close their eyes, and you just tell me where I'm touching you.
Arm. Right leg. Left hand.
Okay. And then to move on to pain, I just have a little dull kind of needle, and you just have them do the same thing. Close their eyes. It's not really sharp. Close their eyes and have them tell you where you're causing some pain.
Arm. Wrist. Knee.
Okay. And you can repeat that on both sides as well. After that, for vibration, you can use your tuning fork to do this, and you just take the patient's hands, and you can just hold out your hand. Hold out your right or left. There you go. And then you can take the tuning fork, cause a vibration on the nodes of their fingers, and have them identify where the vibration is.
Left, right hand, right finger, middle finger. Left ring finger.
Okay. And that's the vibration test. So after you've completed your hands and wrist exam, then you can move on to your back exam. So initially are you able to turn a little bit to your right side? Can I get an angle? Okay. So initially you're checking the spine, just alignment. Check the head and see where the head is placed, the alignment of the head. Check the scapula, make sure that they're even. You want to assess the hips at the same time too to make sure that those are even. And just the, like I said, the ribs and the overall alignment of the spine. Once you've inspected the spine, then you can go ahead and test for scoliosis. And you actually have your patient stand up for this. And then you can just face that wall. And you'd have them bend straight down.
Oh, it's not very good.
It's okay. And then while they're doing that, you just kind of run your fingers down their spine to make sure that the spine is straight. You can stay back up. And then you're going to test for flexion and extension of the spine. So I'm sorry, I'll have to have you stand back up. So she's already flexed basically for the scoliosis part. So extension is just kind of leaning back, and you can just assure them that they won't fall. And okay.